As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community.
And as promised, Dr. Craig Walker is on the set tonight. And Doc, good to see you again. Always good to see you.
Thank you, Martin. Same here.
We're going to talk about critical limb ischemia, and I've heard you talk about that quite a bit over several years, and it should really become an advanced technique, which things to do that y'all fix all that with. But first of all, what is it? Explain to the people what it is.
Critical limb ischemia is the leading cause of amputation in the United States and actually throughout the whole world. It's estimated that about 1.5 to 2 million Americans will have critical limb ischemia. So it's a huge problem that's growing. It seems to be most closely related to advanced age, diabetes, both of which are increasing in America, and cigarette smoking, but certainly it can be outside of those areas as well. And it's typically manifested by one of three symptom complexes. Either A, a person has true rest pain, or B, they have ischemic ulceration, or C, they have early gangrenous or late gangrenous changes. Any of those things, we know that if a person doesn't get appropriate treatment, that they're headed for major amputation. And with a major amputation at the best places in the world, a major amputation below the knee carries a 5 to 8% 30-day mortality. Above the knee, 8 to 12% 30-day mortality. Fully a third of those patients go straight from the hospital to a nursing home at very big expense. And so it's certainly something we want to avoid if we can. Another way that some people look at critical limb ischemia is the pressures in your feet. If they're less than 40% of the blood pressure as it comes out of the heart, then you're just simply not getting enough blood flow to the legs, and they're in jeopardy of dying.
Well, the big who factor, who is at risk for all of this?
Certainly the elderly, absolutely diabetics, and then smokers, of course, in that range. And most of the time, these folks start off having cramping leg pains when they walk, and then they go on to develop, as I said before, rest pain. True ischemic rest pain is pain that hurts, and when they put the legs down, because gravity helps to get a little blood down, the pain may actually be slightly relieved. But with any movement, the leg starts to hurt again, or ischemic ulceration, or these gangrenous changes. When these things occur, if one doesn't do something about them, then you're headed for major amputation. And as I said before, that's a big deal. It's more than just that you lose your limb. Many of these people lose their lives, and so it's very important we intervene on this early.
Any risk factors that go along with everything that you do?
You mean which patients are at risk?
Right.
Yeah. Again, as I said, advanced age, diabetes, both of which are going up dramatically. Cigarette smoking, huge problem, particularly it seems in women. Women start off with smaller vessels. Cigarette smoking really seems to affect them worse, particularly women who are on birth control pills and smoked. And so that seems to be a big risk as well.
All right. We'll take a break. We'll come back. We'll hear from TGMC on the break, and then we'll come back more with Dr. Walker. Don't go away.